Dear friends, I am Dr. Sharath KR. Welcome to my video. You are seeing knee arthroscopy, femoral condyle. This is a meniscus, medial meniscus, which is not a normal meniscus. We are seeing meniscus covering whole of the tibial plateau in the medial side. There is no free margin of the meniscus. There is no posterior horn. There is no anterior horn. Meniscus is continuous from the capsule till the tibial eminence in the medially. This is one of the very rare conditions, very rare conditions called as discoid meniscus. You would have heard of discoid lateral meniscus. I have put some videos in my channel. This is a discoid medial meniscus, which is even rare condition. People with this type of meniscus will have a clicking sensation or locking sensation of the knee while walking. Sometimes they feel like popping of the knee. One of the important findings of the discoid meniscus is that this meniscus is a very thick meniscus compared to the native meniscus. You can see that posterior part there is no meniscus from the capsule, whereas it is in the medial and anterior part and maybe near the root. But this is not the root of the meniscus. Hence, we have to remove it and trim this meniscus into the shape of the medial meniscus. We can trim it and leave it like that, or we could use multiple inside out needles or all inside sutures to close the torn ends and make the shape even more proper with the sutures. Sometimes there will be tear in the discoid meniscus and mobility of the meniscus is more, which is a classification of lateral discoid meniscus, that is a hypermobile type of meniscus, whereas medially, as it is a very rare condition, seeing this medial discoid meniscus itself is a rare. There is no such specific variants in medial discoid meniscus. You can see that when we use the punch, sometimes the thickness of the meniscus is even thicker, more than the opening of the mouth of the punch. Hence, we have to use shaver. We could use radiofrequency ablation also to trim the meniscus into the shape of the medial meniscus. Here we are trimming the meniscus with a punch, and then we will use the shaver and radiofrequency. Posteriorly, as I was telling, there is no specific demarcation or there is no specific root of the meniscus in this case. We are trimming the anteriorly, anteromedially. You can see that anteromedially there is a tear which is seen now because there is a cleavage of this discoid meniscus which is very thick in the anterior anteromedial, and posteriorly there is no meniscus. At that point there is a tear. We are now using RF to make the shape, and then we are using, in this particular case we have used about 4 or 5 inside out needles to reduce or debulk the meniscus, and then posteriorly we have used all inside stitch to create the posterior horn for this case. See, this is the inside out needle. We have to curve the inside out needle because this is in the anterior 1/3 to posterior 2/3. This is almost in the anterior horn. We are using the curved cannula, and we have now took one bite from anterior to posterior. As you can see, how thick is this meniscus? It is almost double the normal thickness of the red zone or capsulomeniscus part. This is the second bite we took. I mean, second inside out needle. So we are trying to fix this inside out needles between the tears or between anterior to posterior area where there is a intact meniscus and the torn part of the meniscus with the probe. We are adjusting the position of it. Once we are confirmed, yes, we have now adjusted it. Once we tighten it, this looks like this. You can see that we have brought it into little anterior. This is looking like a medial meniscus once we have tightened it. This we are pulling and trying to see how it looks when we tighten it. We are going to put another one inside out needle and then the last one will be all inside for the posterior horn. This is one more inside out and one more will be the last will be the all inside. I hope you have liked this video that we have to trim the meniscus. We have to create medial meniscus or lateral meniscus, whatever it is, in the discoid meniscus to make the shape of the discoid meniscus into the normal meniscus. And then now we can see the bone tibial plateau joint, which was not seen before. This completes the repair of the discoid medial meniscus. Thank you for watching this video. If you have liked this video, please like my share to your family or friends and subscribe to my channel for more such interesting videos. Thank you.